Can Alzheimer's disease be cured? Can it be prevented? Well, at this time, while we don't have the perfect way to prevent or cure Alzheimer's disease, science has shown us that we can still do a lot and we can still be able to grab the bull by the horns and do something because we aren't powerless in the fight against Alzheimer's disease. While we don't yet have a cure, there are a variety of different things that a person can do today to reduce their risk and minimize their chances of getting cognitive decline due to Alzheimer's disease. For example, there was an important article that came out just this past summer that showed that 4 out of every 10 cases of Alzheimer's disease may be preventable if that person does everything right. What does that mean? There are a variety of risk factors that can increase a person's risk for Alzheimer's. For example, not being physically active and eating an unhealthy diet can absolutely increase the risk of Alzheimer's disease. Having conditions like high blood pressure, high cholesterol, and diabetes absolutely increase the risk of Alzheimer's disease. For example, just having diabetes alone doubles the likelihood of developing Alzheimer's disease. But if we can treat high blood sugars, if we can treat high cholesterol, and if we can treat high blood pressure, we can slam on the brakes towards Alzheimer's disease. Just one little note. With Alzheimer's disease, the devil is in the details. What I mean by this is, let's talk about blood pressure control. A person may be satisfied that their blood pressure is running in the 140s over 80s, or a physician may have told that person, it's a little bit high, eat less salt, exercise more, take these blood pressure medications, and it should come down. However, if we realize that the blood pressure is still high over time, there have now been studies that show that optimizing blood pressure control from the 140s over 80s to the 120s over 70s, just for 3 years, will reduce the likelihood of developing the earliest symptomatic stage of Alzheimer's, called mild cognitive impairment, or MCI, by 19%. So the take-home point here is we don't have a magic pill or a magic cure for Alzheimer's, but the combination of multiple life changes and medical management can absolutely make all the difference.